Exposure to bloodborne diseases is a serious concern in today's society. Because of this, the Occupational Safety and Health Administration recently passed a new regulation dealing with bloodborne pathogens, the disease-causing microorganisms found in human blood, as well as human blood components and products. In this program, we'll show you how exposure to bloodborne pathogens occurs, so you can help protect yourself and co-workers from contact. You may also want to read the regulation itself. Your course instructor will tell you where to find the nearest copy. While there are a number of bloodborne pathogens, those causing the hepatitis B and human immunodeficiency viruses pose the greatest threat. Human immunodeficiency virus, or HIV, is the newest of the bloodborne diseases and is spreading rapidly. It is estimated that by the end of 1992, over 2 million people in the U.S. will become infected. Currently, no vaccine exists to prevent infection of HIV, and there is no known cure. Symptoms experienced at the onset of HIV infection can vary. They include weakness, fever, sore throat, nausea, headaches, diarrhea, and other flu-like symptoms. However, many people with the HIV virus can show no apparent symptoms for years after their infection. Controlling the spread of HIV is very important. It is generally believed that those who contract the HIV virus will ultimately develop acquired immunodeficiency syndrome, or AIDS. AIDS results in a breakdown of the immune system, canceling out the body's ability to fight off other diseases. Hepatitis is a liver disease. It usually results in an inflammation of the liver and frequently progresses to more serious conditions, including cirrhosis and cancer. Each year in the U.S., there are about 300,000 new cases of hepatitis B, the most prevalent form of the virus. Fortunately, while there is no cure for hepatitis B, a vaccine does exist that can prevent infection. After exposure, it can take 2 weeks to 6 months for hepatitis B to develop. Early detection is extremely important, since vaccinations begun immediately after exposure to the virus can often prevent infection. The initial symptoms of hepatitis B also resemble those of a mild flu. There is a sense of fatigue, nausea, loss of appetite, and possible stomach pain. Often jaundice, a distinct yellowing of the skin, will eventually develop, as well as a darkening of the urine. However, as with HIV, those infected with hepatitis B will frequently fail to show symptoms for some time. Bloodborne diseases are most often transmitted through parenteral exposure. This is where microorganisms enter the body through breaks in the skin or mucous membranes. These exposures most often occur through punctures from infected needles and human bites, or where skin abrasions or cuts are contacted by potentially infectious material, such as blood, human tissue, vaginal secretions from discarded hygiene products, and other body fluids with blood in them. Preventing parenteral exposures to these materials is one of the major parts of the OSHA bloodborne pathogens regulation. Let's take a look at what the regulation requires of your facility. The first step involves the creation of an exposure control plan. This plan spells out how your facility will address the requirements of the regulation itself, and includes a determination of each employee's potential exposure to bloodborne pathogens, and an examination of ways to limit or eliminate exposure. The exposure control plan also deals with setting up a hepatitis B vaccination program, as well as procedures to be followed whenever an accidental exposure occurs. Other parts of the plan include warning signs and labels, employee training, and the keeping of necessary records regarding exposure, vaccination, and training. The plan must also incorporate the use of universal precautions, which treats all human blood and certain other body fluids as if they are known to contain bloodborne pathogens. As you can see, OSHA insists that your facility's exposure control plan be very comprehensive. If you would like to look at your facility's plan, see your training instructor or supervisor. Now we will take a closer look at the most important parts of that plan. Labeling is the most visible requirement in the regulations. Any potentially infectious materials, such as blood drawn in a nurse's office, must be marked with a biohazard label. Labels must also appear on any equipment and materials suspected of being contaminated, such as stretchers and other equipment used by the first aid team or fire brigade in your facility. The word contaminated indicates the presence or anticipated presence of potentially infectious materials on an item or surface. Biohazard labels are fluorescent orange-red with the biohazard symbol in a contrasting color. The word biohazard will also appear on the lower portion of the label. Red containers or bags do not have to be labeled, since their red color indicates they may contain biohazards. One of the places you will see biohazard labels is on containers of regulated waste. Regulated waste refers to several things, including potentially infectious materials, such as blood, contaminated items, such as bandages, bedding and towels, contaminated needles and broken glass, and containers which may have had infectious material in them. There are a number of ways that you can recognize activities that might involve exposure to bloodborne pathogens. The most obvious is to look for biohazard labels. If you aren't sure what materials the labels apply to, ask your supervisor. You should also be aware of the tasks you perform that may expose you to blood or other fluids, or tissues where bloodborne pathogens could be present. Activities where you might reasonably expect to encounter bloodborne pathogens include emptying trash and performing other cleaning duties, changing linens on beds, stretchers, or examination tables, refilling first aid supply cabinets, processing soiled laundry, working in company clinics or medical offices, and working as a member of an internal first aid or fire brigade team. Your employer has compiled lists of job classifications and activities that may present risk of exposure. These lists can be found in your facility's exposure control plan. There are many ways you and your employer can work to reduce exposure to bloodborne pathogens. These include the use of universal precautions, remembering to treat all blood and body fluids as if they are infectious, engineering controls, work practice controls, the use of personal protective equipment, and appropriate housekeeping practices. Engineering controls refers to equipment or machinery that can minimize exposure, such as using a dustpan and broom to pick up trash that may contain contaminated material, or using tongs to pick up contaminated broken glass. Work practice controls reduce the potential for exposure by focusing on the safest ways to perform tasks. Hand washing is one of the most important. If you've been involved in a situation where you may have been exposed to bloodborne pathogens, OSHA requires that you wash your hands immediately after removing gloves and personal protective equipment. Remember to wipe off the spigot handles with your towel when turning it off, so you don't recontaminate yourself in the process. You must also wash your hands immediately after contact with blood or other potentially infectious material, as well as flush your eyes, nose, or other mucous membranes with water if they have been exposed. OSHA considers housekeeping practices to be very important to the control of exposure situations. If your job involves cleaning or housekeeping of any type, which might bring you into contact with bloodborne pathogens, there are several steps you must take. Written cleaning schedules specifying methods of decontamination must be maintained to keep all areas clean and sanitary. All equipment and surfaces must be cleaned and decontaminated after contact with blood or other potentially infectious materials. If they are obviously contaminated, work surfaces must be cleaned immediately with an appropriate disinfectant. Otherwise, this should be done at the end of the work shift. Protective coverings on equipment and plastic bags in wastebaskets or other containers must also be replaced when contaminated. Rules also govern the handling of other regulated waste in your facility. This includes contaminated personal protective equipment, bandages, linens, and other potentially infectious materials that are being disposed of. This waste must be placed in appropriately labeled, closable, and leak-proof containers. Containers must be closed during handling. If the outside surface of the primary container is contaminated, an appropriately labeled secondary container must be used as well. And this waste must be disposed of in accordance with existing federal and state regulations. If there is a danger that items contained in the waste could puncture the primary container, the secondary container must also be puncture resistant. Another part of the regulation concerns contaminated laundry. Laundry should be handled as little as possible and always bagged or containerized. It must never be sorted or rinsed at its originating location. Labeled or color-coded bags are required to transport laundry. Bags must be leak-proof if the laundry is wet and shows a potential for soak-through. Of course, all laundry must be handled with gloves and other appropriate protective equipment. OSHA also addresses personal workplace activities. Never smoke or apply cosmetics, lip balm, or contact lenses in work areas where exposure may occur. Never eat or drink in these areas. Food or drink should never be stored where blood or other infectious materials are kept. The last type of workplace control the regulation addresses concerns equipment. Before any piece of equipment is serviced or shipped, it must be inspected for contamination. Any required disinfection should be completed as soon as possible. Remember, if total decontamination cannot be attained, the equipment must be labeled as to which parts remain contaminated. All employees or service personnel who may come in contact with the equipment must be notified of the location and type of contamination. The use of personal protective equipment is another important part of the Bloodborne Pathogens regulation. It must be worn whenever there is a chance of exposure to blood or other potentially infectious material. Gloves are mandatory in these situations. Disposable gloves should be replaced as soon as possible after becoming contaminated. Never attempt to decontaminate and reuse them. Replace disposables immediately when torn or otherwise damaged. Removing any rings before pulling on your gloves will help keep them from tearing. Utility gloves, usually rubber or vinyl, are heavier and can be reused after decontamination. However, they must be discarded if they are cracked, peeling, or otherwise damaged. Remember, you must change your gloves and wash your hands after each exposure. Masks and eye protection should be worn whenever there is a chance that fluids may splash or splatter. Standard safety glasses protect the eyes from direct exposure from the front. Side shields provide added coverage. Safety goggles fit snugly and provide complete protection of the eye region. Pocket and other face masks are designed to protect the mouth and lip area. They should be worn whenever eye protection is used. Coats and other protective clothing can provide protection for much of the body. They should be selected based on the degree and circumstance of anticipated exposure and must effectively prevent the pass-through of fluids and materials. Your facility has personal protective equipment available for you in your work area. If you are unsure of the location of a particular item, ask your supervisor. You also need to be aware of your facility's procedures for handling personal protective equipment once it has been used. Know the location of collection and disposal points and use them. Remember, you must take off your equipment before leaving your work area. Good work practices and the use of personal protective equipment can substantially reduce the risk of exposure. Vaccination, however, is the first line of defense against infection. There is, of course, no vaccine for HIV. However, a vaccine for hepatitis B has been available for some time. The vaccine is administered in 3 injections, given several months apart. Hepatitis B vaccines are safe. There is no possibility of infection through the vaccine itself. And over the years, vaccination has proven to be very effective in preventing hepatitis B infection. Your employer has set up a free hepatitis vaccination program for all employees at risk of exposure. Your training instructor can give you more information. If you're at any risk, it is important that you be vaccinated. It is so important that OSHA requires you to sign a form if you decline the vaccination. If you are accidentally exposed to hepatitis B infected blood and have not been vaccinated, your employer will offer you an accelerated vaccination series, also at no cost. This after-the-fact vaccination will not always prevent you from developing the disease. However, many forms of hepatitis B are slow to cause infection. Given in time, vaccination may prevent the disease. As careful as we may be, accidents involving bloodborne pathogens can occur. You need to know what to do in case of such an emergency. First, if you've come into contact with any material, you should wash the affected area with soap and water as quickly as possible. Then, immediately take the following steps. Contain the material using absorbent barriers or by soaking up the spilled material. Next, the spill area should be cleaned with your facility's approved disinfecting solution, such as 110 5.25 sodium hypochlorite, more commonly known as diluted bleach. Once the spill or leak has been dealt with, any contaminated materials should be disposed of in an approved waste disposal container. Any contaminated personal protective equipment should also be discarded or recycled for decontamination. A number of people will need to be notified about the incident, including your supervisor, the safety department, and your company nurse or medical office. If you are involved in an exposure incident, you may need to complete an incident report. Immediately following the exposure, your employer will give you a written description detailing the routes of exposure you experienced, the circumstances under which the exposure occurred, and, if possible, the identity of the individual from whom the potentially infectious material originated. Your employer will also try to determine if the source individual's blood is infected with either hepatitis B or HIV. With your permission, your employer will test your blood to determine if an infection has occurred. An appointment will be arranged for you with a healthcare professional who will discuss the results of your blood test as well as any recommended treatment. Your employer will provide the healthcare professional with information, such as the type of work you were doing when the incident occurred, the result of the source individual's blood test, and any of your medical records which are relevant to possible treatment. Your situation will then be evaluated and discussed with you. If appropriate, medical treatment may then be recommended. If hepatitis B vaccination is called for, it will be provided by your employer at no cost to you. The healthcare professional is also required to verify 4 things with your employer: that you have been informed of the results of their evaluation, that they have discussed with you any medical condition resulting from the exposure which would require follow-up, whether hepatitis B vaccination is called for, and whether you have received the first part of the vaccination series. All other information that results from your medical evaluation will remain confidential. Bloodborne pathogens are dangerous, but by combining engineering controls, good work practices, and the use of personal protective equipment, exposure can be greatly reduced. So think safety and work smart. Protect yourself from the bloodborne pathogens you may encounter in your job.